Hey, let's welcome back to the show our preferred provider when it comes to all things medical, and that's Dr. David Klein of the Stages of Life Institute in nearby Longwood, just a hop, skip, and a yodel from this area. And when you go up there, you're going to find not only a great doctor's office, a super practice, a lot of board certifications on that wall. You'll also find the nutraceutical store, and listen, Robin, wait for it, the esthetician.
Oh, well done.
Am I getting there?
You're getting there.
All
Yeah,
right.
that's a tough one.
It's that time of year again, which I found out when my mother fell ill to this 2 or 3 years ago. Shingles is nothing to mess with. This stuff is bad news, and there is a shingle time that they're giving the vaccines.
Oh, yeah. Well, actually, they'll give you the vaccine year-round, but there are 2 times of the year that you'd really had best have had received it. Well, what I'm talking about is that shingles has a seasonality to it. It tends to have a greater incidence in the spring and in the fall. Well, guess what? Florida listeners, this is the fall, okay? You may be running around in shorts and flip-flops, as I do. However, it is still the fall, and infectious diseases have a tendency to run in, they run in the calendar. Okay, so we're going to have a flu season. It's coming up. But we all have a shingle season that people don't pay a lot of attention to. Well, many of the listeners of this station are actually of an age where shingles might be a concern. Okay, when do you start seeing shingles? Well, the older you are, the more frequent the presentation becomes. But the youngest patient I ever saw with shingles was 14. Okay, now they say, well, you can't get shingles more than once. Utter absolute nonsense. Okay, you can get shingles many times. One patient I had with an immune system issue, which took some time to correct, was getting shingles every month. Her doctors told her it was impossible for this to occur, but it was entirely possible. And in fact, this individual suffered it for many, many years until we sorted it out and fixed it. So what is shingles? Well, shingles is a reoccurrence of an earlier infection called chickenpox. So many of you had chickenpox. In fact, just about every one of you had chickenpox as a kid, whether you had the obvious rash or not. But then as time goes by, the immunity to the chickenpox diminishes, just as it does with every infection. Okay, how long does it take? 10, 15, 20 years, and all of a sudden the immunity is gone. Okay, when you're a kid, it lasts a little bit longer typically, but as you get older, it does not. So you have these cells, these not cells, they're virus particles sitting dormant in the dorsal column of the spinal cord. They sit there and wait. Very patiently, they wait and wait and wait until something happens. Something triggers it. The immune system takes a bump. Could be the flu, could be this, could be that, could be a weather change, oddly, and then they wake up. And then they start to replicate, and they work their way down the cell body. You know, from the cell body down the axon all the way to the skin. So you have this odd, weird feeling in the skin, usually in the face, over the eye, or in the cheek, but it could be in the chest or really on any area of the skin in your entire body. I've seen them all. And it feels weird for 3 or 4 or 5 days. Something's not right. You feel rather rotten. There's something not happening correctly. And then all of a sudden, you start seeing little vesicles, something breaking out in the skin. And then the diagnosis of shingles is a little bit easier. Although even still, maybe 9 out of 10 don't get diagnosed in time to properly treat it. And then the rash gets worse and worse and worse. The shingles comes from the appearance of the skin where it actually dies off. It's like having gangrene of the skin. So initially it breaks out, then the blood vessels constrict, the skin sloughs off, and you have a misery the like of which you've never had before. Now, the only reason why I really care about this, okay, and the only reason why you really should, is that 1 person in 10 who develop shingles will have pain for the rest of their life. Now, I don't know about you, but I'm not going to work my entire life to save up for retirement and then suffer it in pain for the rest of my life because of some stupid virus particle that woke up in my spinal cord. So what do? Okay, the first thing is, if you get this, okay, and I'd be willing to bet there are at least 200 or 300 people right now listening to this that are having an itchy sort of a feel in their skin, wondering what it is. It's on one side of the chest, one side of the face, and they're going to ignore it until it breaks out. You have 3 days, 5 days most, in order to start on the antivirals to make a difference. Now, shingles is an interesting process. If you take the valcyclovir or the acyclovir early enough, it will abort the issue. Doesn't prevent all of the problems, but it aborts the infection, cuts back in what's going to end up being scarring of the skin. It doesn't matter. The virus doesn't care if it scars your face or your chest. It will scar. So what do? You start the antibiotics early and hard. If you suspect that this is shingles, you take the antibiotics. They used to be very, very expensive. Now they're very inexpensive. We sell them in the office for 10 or 20 bucks. It's not a lot of money. It's infinitely affordable. You know, you just have to get to the doctor's office and suggest in ever so gentle terms, hey, doc, I think I might have shingles. Then they look at you and you go, you know, maybe you're right. And then you get the prescription. Now, shingles has 3 phases to it with regards to pain. The first of which is when the blisters start to come out, it's vasoconstriction, which is to say that the blood vessels start to constrict, and then you end up with this sloughing of the skin. That's blocked, okay, by either using topical nifedipine, which is a medication that I put together many, many years ago for brown recluse spider bites, believe it or not.
Ooh.
But you apply it topically, the blood vessels open up, and it prevents the sloughing of the skin. Stuff is not terribly expensive, but you do have to get it done. That's the first bit of pain. So you can block that with Tylenol. You can take whatever painkiller you want. We'll take care of that. Could be hydrocodone, could be oxycodone, could be codeine, could be tramadol. It doesn't make a lick's bit of difference. But then there's a second pain that follows, and that's from the degradation and the breakdown of the axon itself. Okay, now what do you do to take care of that? These are anti-inflammatories. So I start everybody on naproxen. And why do I start them on naproxen early, and why do I choose naproxen in particular? It's one of the few anti-inflammatories that crosses the blood-brain barrier. Getting back to the beginning of the discussion, where is the virus particle? It's in the dorsal column of the spinal cord. So you have to take an anti-inflammatory that will make its way through the blood-brain barrier. So naproxen is a natural choice. If you're cheap and you don't want to see the doc, go get yourself some Aleve. And if you're really cheap, get the generic Aleve. It works just fine, okay? But you have to take enough of it. So typically the way I use it is 3 tablets in the morning and 2 in the evening for this process. It straightens it out. How long will you be on it? About 3 to 4 months, because the inflammatory process takes time to start, it takes time to complete, and it takes time to be relieved. But then there's a third pain, and this is the one that drives people nuts. And it's as the nerve goes into a regeneration phase, because nerves do regrow. It starts from the spinal cord and works its way out along that inflamed tube until it hits the skin. If you get the anti-inflammatories in quickly, and if you stay on them long enough to prevent scarring, okay, of the nerve tube, this is not skin scarring, this is internal scarring, then the nerve will regenerate more or less normally. Okay, then you don't end up with a post-herpetic neuralgia. But God help you if you don't do this. That nerve starts to regenerate. There are 3 places typically where the nerve gets hung up. It'll get hung up about 3 inches lateral to the spinal cord. Okay, that's where the first dorsal penetrating cutaneous branch comes off. There will not be a test on this. And, you know, that's the rarest of the 3. The second one is in the mid-axillary line where the axillary penetrating cutaneous branch comes out. Very, very common place to develop pain. But the most common is the distal one, which is alongside the chest. You know, the chest wall in the front. Well, why is this? Because these nerves regenerate at 1 millimeter a day. Well, let's figure that one out. Okay, that's 1,000 days from the beginning to the end to get this thing cured, get this thing corrected. It takes almost 2.5, 3 years for people that have shingles on the chest for it to resolve. God help you if it's in the leg. It can be more than that because these nerves are longer. In the face, of course, because that is a 3 to 500 millimeter length of nerve, it doesn't take nearly as long. But that's the name of the game. So there are 3 phases to post-herpetic neuralgia. Hope you don't get it. But that brings me to the moral of the story. Stop what you're doing tomorrow morning and get the shingles shot, okay? Because the shingles shot can be obtained easily enough. It's not terribly expensive. They don't give it away, but you better do it because going down with shingles is not something you ever want to do. I bought the shingles shot for myself and waited a little too long to take it. Ended up coming down with shingles, and I keep an expired bottle of shingles vaccine in my office to remind me how stupid I can be. I would hope that you would learn from my lesson. Get the darn shingles shot. If asked the question, gee, I had the shingles 3 years ago, when do I go and get my shingles shot again? Because my neighbor told me that I could never get it again. I'd say, before you shoot your neighbor, okay, you want to give it about 5 years, okay? Because what you did was give yourself a natural shingles shot, that 5-year duration. But if you had the shingles shot 5 years ago, I'd be thinking about getting it again.
Can you get the shingles vaccine the same day as the flu vaccine?
Yes.
You can do it the same day.
You can do it the same day, minimal inconvenience. You just do it.
Very good. All right, follow the doctor's advice and physician heal thyself. Next time you're thinking about not taking that shot.
Well, I'm thinking about taking it now because it's been almost 10 years since I had the shingles.
All right, we'll do that tomorrow with me too. All right, what are we doing with the stages of life?
We are calling the stages of life at 407-679-3337, or you're checking us out on the web at stagesoflife.net. We're also on Facebook at Stages of Life Medical Institute. Our office hours are Monday through Thursday from 8 to 5. The health store is open during those office hours, and we invite you to come on in and see what we have.
All right, there we go. And we'll have the doctor again tomorrow. We're running him 5 days a week now to help you right here on the Rob Newton Resource Hour. Newton Resource